Okay, so now we're going to move into coronal imaging anatomy. So here is the just the first image you can see on the right side. This is where the various images were taken from. Again, we're not going to hit every single one of these, but just to kind of give you a reminder of the structures that we're passing through as we move from anterior to posterior along these images. So again, this is just the first image. So we're several slices back posterior from the abdominal wall because we're going through the part of the stomach, so you can see the stomach coming across right here, and then the gallbladder as well. So looking at the image down here, you can see the liver quite well, the stomach, the gallbladder, and then various loops of small intestine are shown in this image, as well as is just a small part of the colon. You can see part of the transverse and descending colon coming across, and then you can also see just a small amount of spleen right there as well. So again, moving back a little bit further, you can see a little bit more of the spleen now that we're a little bit more posterior. The gallbladder, again, gets a little bit larger at this point as well. You can see the cecum right here along with the ascending colon. And then, again, various loops of small bowel shown sort of in the middle aspect of this image. And then the gastric antrum can be seen as can part of the gastric body. So again, you can see at least parts of the stomach cutting across the center of your image, and then part of the heart was also picked up right here. Looking at the next image now, we can really appreciate the portal vein and its tributaries. So again, the portal vein you can see right here, along with the splenic vein coming in, and then the superior mesenteric vein coming up, draining into it there from below. So that's some of the really key anatomy in this image. Again, you can see more of the small intestines here, as well as part of the ascending colon and cecum down in this region. Looking at the next image, moving a little bit further posteriorly, kind of interesting in this image, you can see the common bile duct. So again, here we see the common bile duct, as well as the portal vein located right next to it, moving right into the liver. So again, you can see the relative size difference between the IVC and the common bile duct. You also see part of the duodenum or duodenum, so you can see the descending and our second and third parts of the duodenum quite well in this image, and how they're crossing over the venous structures here, including the inferior vena cava. So you can see the inferior vena cava down here on the left, again shown in this image right here, and then the aorta located right next to that. So that's what this is showing over here. And then part of the left renal vein you can see cutting across right here as well, which means the superior mesenteric artery should be coming over just over the top of that left renal vein. Now you can see a little bit of the left kidney here in this image, and then you can see just a small part of the bowel, but what's really well visualized in this image, of course, is the IVC. You can see the IVC really well. You can also see the left renal vein. So again, looking at the image at top, here's the IVC, again aorta located right next to it, which you can see in this image down here, and then note the left renal vein cutting across the anterior surface of the aorta to join up with the IVC before traveling up into the liver. And then we see the spleen now up right underneath the left hemidiaphragm. You can also see the GE junction, so the gastroesophageal junction is hopefully really clear right through here. We can see the esophagus, and then now the fundus of the stomach. And again, you see that quite well up here. And then we see part of the psoas major muscles showing up distally. Moving to the next image, you can see the psoas major muscles even better bilaterally. Now you can also appreciate both the right and the left kidneys, and then you can see the aorta quite well, along with the right renal artery cutting across here, going to the hilum of the right kidney. And then we still see part of the IVC passing through the liver over here on the right hand side as well. Right hand side of the patient. And you see just part of the fundus of the stomach, and then a good swath of the spleen is seen in the left upper quadrant. And then finally we see the posterior most aspects of the kidneys, the liver, and the spleen in this next image. And then sort of interestingly, you get a really good view of the vertebral bodies and the IV discs, or the intervertebral discs in between each. And then down here distally, you can see the cauda equina quite well floating in CSF. And same thing here, you get a view of the terminal part of the spinal cord and even the conus medullaris down here as it's turning into the cauda equina, which is kind of a cool view. So now we're going to look at some sagittal images. So again, the upper right hand image shows you where sections were taken from, though again we don't go through every single one of them, but we do go through a majority of them. And we're going to start out with the first image. You'll notice the spleen showing up, so we're going to be starting out over here on the left hand side, the patient's left, and moving our way over to the right. So again, here you get a good view of the spleen with abdominal fat located sort of around that, forming this sort of a halo effect located around the spleen, which is more of a hyperdensity. Now we're moving again from left to right, so we see more of the spleen. You can see part of the left kidney, as well as the parts of the descending colon coming down here as well. So here's the colon, the kidney, and then the spleen. Moving further to the right now from the previous image, we can see more of the stomach next to the spleen, much more of the kidney, including the hilum. So you can see the vasculature moving into it, the artery, and then two of the renal veins. And then we see parts of the small intestine showing up, as well as the transverse colon, and as I mentioned before, part of the stomach next to the spleen in this individual. And just above all those structures you're seeing right here is the heart with the diaphragm right below that. Next image, now we're finally starting to see part of the liver. So again, you can make out just a small part of the liver right here. And then you can see just part of the stomach here and right here. So again, two components of the stomach. You can also see the pancreas relatively well. So this is the pancreas, and remember that close relationship with the splenic vein. So you can see that pancreas with splenic vein. Just below that, you can see parts of the small intestines located right through here, along with the transverse colon cutting across just about the midline level of or midpoint of the sagittal section. Next image, it looks very, very similar. You just see a little bit more of the liver parenchyma, and then again you still can see the pancreas as well as parts of the stomach moving down towards the duodenum, and then parts of the small intestine down below that as well. And then you get a really good view of the aorta actually in this image. So you can see here's the aorta. You can see both the celiac and the superior mesenteric arteries branching off. And note the superior mesenteric is traveling right over the left renal vein. And then you also see it traveling over part of the duodenum. So the third part of the duodenum is going to be crossed over by that superior mesenteric artery. So make sure you look out for that. Again, you should be able to see both the celiac trunk and the superior mesenteric artery coming off. Here's that left renal vein, and then the third part of the duodenum. Again, both of these two structures being passed over by the superior mesenteric artery. So very important relationship to keep in mind. In the next image, you see that even better. So here's the superior mesenteric artery. You can see some of its branches. Here's the third part of the duodenum, the left remnants of the left renal vein, and then you can also make out part of the IVC coming up here as well. So again, superior mesenteric artery, third part of the duodenum, and then left renal vein right there. Liver parenchyma, you can see that, transverse colon, and parts of the small intestine below that, along with part of the stomach right beneath the liver. The next image, we get a good view of the confluence of or formation of the portal vein. So you can see the superior mesenteric vein as it's coming up to help form the portal vein. And so again, I think you can kind of make that out right here, and then here you see the portal vein forming before it's moving into the liver. And then you get a really good view of the IVC in this image as well. So you can see the IVC as it's ascending towards the liver. The next image, we can now start making out part of the gallbladder. So you can see the gallbladder right here, right beneath the portal vein, located within around the liver parenchyma. And then we also can finally make out part of the right kidney along with the hilum, so you can make out the hilar region of the kidney quite well. You get some good views of the small intestine, primarily the jejunum, a little bit of the duodenum, and then also the transverse colon. You can still see, again up here, kind of appreciate those relationships. Moving a little bit further lateral, now we get an even better view of the gallbladder, so you can see that gallbladder right there. Along with the hepatic flexure and the ascending colon now are coming into view, and then the far right side of the right kidney you can see right here. And then finally, in the last image, it looks a lot like the first image that we saw on the far left, but now we're just looking at the liver, and then again you get a little bit of this halo effect as a result of some of this fat that's surrounding the liver. Now we're going to look at a couple of vascular scans. So in this one, you can obviously make out the celiac trunk. So you can see that coming out, branching directly off of the aorta, and then giving off its various branches. You can see the splenic artery and its tortuous course. So that's always going to have kind of a interesting view on a cross-sectional image. And then you can see coming off of the common hepatic, giving off the proper, and then left and right hepatics from there. Looking back a little bit further posteriorly, we can see both of the left and right renal arteries as they're supplying the kidneys, as well as the renal veins. And again, you can see the left renal vein as it crosses underneath ultimately it's going to cross underneath directly under the superior mesenteric artery. So keep that relationship in mind. Then you can also make out some of these lumbar veins, or arteries rather, if you're lucky. So in the image over here, you can see the abdominal aorta, renal arteries, celiac trunk, splenic artery, and it's again tortuous course, and then common hepatic artery giving off proper hepatic, as well as gastroduodenal, though you don't see that in this image, and then right and left hepatic arteries. Next image, this is a really nice view of the portal vein. So you can see where the portal vein is forming here by the superior mesenteric vein and the splenic vein. So again, splenic vein coming across in close proximity to the pancreas. And then here's the superior mesenteric vein dumping into or joining with the splenic to form the portal, and then giving off various portal branches within the liver parenchyma. And then don't forget that the inferior mesenteric dumps into the splenic vein. So you can see that happening right here, and then again the formation of the portal vein right there. And finally, we have a really good view of the abdominal aorta, and then you can see the celiac trunk with the splenic artery right here, and then superior mesenteric artery sitting right over the left renal vein, and then the third part of the duodenum as well. And you get a pretty good sense of the course of the superior mesenteric artery, and then you see the proximal part of the IMA, or the inferior mesenteric artery there, and then multiple lumbar arteries that are branching off of the aorta posteriorly.